evening, everyone. Tarangini, a national level seminar with paper and poster presentation presented by Team Ayur Apta. So once again, we are humbled to welcome you all here. So without further ado, let me invite our respected faculties and now I invite our participants and wish you all the very best for your presentation. And before we get started, let me remind you, the program is live on YouTube channel and it will be saved. So please don't unmute yourself unnecessarily. And dear participant, your maximum time allotted for the presentation is 8 minutes. So kindly do follow the time limit. So now we can start, and first we have a paper presentation and I invite Dr.Haritha.V.
Myself, Dr. Haritha, final year PhD scholar from the Department of Kaumarapratya, here to present significance of Raksha Karma and Dhoopana in child health management. Moving to the introduction, general protective and curative measures mentioned in various contexts like operative procedures in Shalyatantra and Swasthavrita can be included under the term Rakshogna Karma. In modern view, this can be compared with the impact on health due to unknown causes, infections, or psychiatric disorders. The Rakshogna Karma should be employed during the first 11 days till Namakarana Samskara is advised. We can divide this to Sammaiah and Vyaktigata Raksha. Aims of Raksha Karma: protection from Grahabada, prevention of mental disorders, curative functions, reduction of intensity of manifested diseases, and the child and mother should be protected as a wounded person. Next, going to Sammaiah Raksha Karma. Few of them are, the place should be surrounded by branches of Adani, Gadira, Pilu, and Parushaka. The seeds of mustard, linseed, rice and kanganika should be scattered all over. A pestle should be, pestle used for pounding the rice should be erected obliquely at the main door of Sodika Griha. The pottery containing Rakshogna drugs, that is Kushta, Vacha, Hingu, etc., and fine particles of other grains has to be made. It is tied and hung appropriately, not only in the needs of mother and baby, but also at the main entrance of the Sodika Gara. Water pots and vessels should be kept in the room. The stem of Adani, Gadira, Karkandu, Pilu, and Parushaka are shielded all around inside the room. Dhoopana of Kumaragara should be done with Gugulu, Agaru, etc. Oblation to fire god is done twice daily with rice particles. Chanting of Atharva Vedic hymns together with auspicious performance of Bali, Japa, and Homa to fire god should be conducted twice daily. They should, rural people sing folk songs continuously these 12 days to watch an insect which grows in cow dung coming and hurting the child with trust. Parivijanam is also mentioned. Next, we're going to Vyaktigata Raksha. It is done for the there are 5 nurses appointed to look after Mahavira for the purpose of breastfeeding, cleanliness, dressing and decoration, playing with the baby, carrying the baby. It indicates the ways to nursing care required for an infant. A child should be nursed as that of wounded person. Next is Abhyanga and Snanam. The child should be daily anointed with a Sahavidyadi Thailam and Bala Thailam, followed by Udvartanam and a hot water bath. The roots of Murva mixed with both Haridra and Hosegram should be used for Udvartanam. For bath, the water should be medicated with a paste of Eladi Gana or Jivaniya Gana drugs can be used. Next is fumigation. Daily after bath, the child is fumigated with the Rakshogna drugs. Raja Martanda and Yogaratnagara advises that fumigation by cock's feather dipped in cow's ghee for 7 days would prevent all Graha Rogas. Next is Dhoopana. Dhoopana dravyas are protective measures elaborately mentioned in Kashyapa in Dhoopakalpadhyaya. Kashyapa has explained multidimensional utility of Dhoopana by showing some special interest in it, as it is non-invasive and it is also easy to implement in children. He mentioned 3 types of Dhoopanas, such as Dhoopa, Anudhoopa, and Pratidhoopa, based on karma. On the basis of origin, he again divided into Jangama and Stavara. Some Dhubas are also mentioned by Kashyapa. They are Rakshogna Dhuba, Dashanga Dhuba, Uttama Dhuba, Moha Dhuba, Grahagna Dhuba, Punya Dhuba, etc. Next, care of Brahma and ears. After Dhupana, a pad of cotton dipped in Tila Taila and Bhila Taila should be kept over her Murdni, and both the auditory meatus should also be blocked with a such piju, especially during the first few days. Shaya and Vastra. In routine nursing, the child should then be transferred into bed of soft, clean, light, and good fragrance. The dirty cloth with the infant's excreta should be reused only after subjecting them for proper washing, drying, and fumigation. For fumigation, the linen, the following Rakshogna drugs should be used along with the ghee besides Vayasta, Jadila, Ashoka, Palankasha, Rohini, and Sarpa Nirmoga. Vriddha Vagbada explained that fumigation with a feather of naturally dead crow mixed with a trivrit can be used. Vayu, free and pure natural air is always preferable. And for fanning purpose, the tender stem of Pilu, Badari, Nimba, and Parushaka should be used daily. Mala Dharana. Various precious jewels or the right horn tip of the living animals like rhinoceros or ox, mysterious drugs like Aitri, Jivaka, Rishabaka, etc. are made into lockets, and the child should be made to wear them in his neck. This is said to protect longevity and intelligence and prevent Graha Rogas. Next, going to general management, the environmental temperature should be neither too hot or too cold. The child should be protected from blowing airs, hot sun, lightning, toxic creatures, and snakes, etc. He should not be frightened with loud sounds and voices. Attracting and safe toys can be offered to the baby. The hygiene of the bed and clothing should always be ensured. Discussion. Care indicated similar to that of wounded person denotes preventing from infections by isolation. It is also used as a readily preserved weapon to encounter any harmful animals. The insect referred above may be carrying tetanus infection from cow dung. The insect may get attracted by the neonatal smell. The overall 12 days might be aimed at preventing neonatal sepsis. Role of Dhupana as protective measure is proven already, but use of certain animal products as Dhupana look outdated in present practice, but dried stool devoid of bad smell, rich in urea, uric acid, nitrogen, and ammonia. When burnt, release of certain chemical with oxides may yield beneficial effects. Conclusion. Various acharyas have been mentioned, various procedures of Rakshogna Karma for children. Drug used are antiseptic, antibacterial, bacteriostatic, bactericidal, and disinfectant in nature, like Jadi, Pushpa, Vacha, etc. Rakshasas can be understood as microorganisms. The Rakshogna drugs act as absorbents and disinfectants. So these procedures are having important role in child health management. Dhupana technique have nebulization effect in children, and strong smell of these drugs can act as potent antibacterial agent. Rakshogna Karma is having important role in child health stabilization and curing the diseases also. These all are the references. Thank you.
Thank you, Dr. Haritha. Next, I invite Dr. Rushikesh Jadhav for the poster presentation.
We are studying today's, I'm explaining Nidan Panchaka, explained by Charka in Ayurveda Nidan Sthana. So due to lack of time, I'm explaining in first way. The Nidan, which is also called as first is Hetu, Nidan Panchakas, first is Hetu, which is divided in further as a Sannikrushta Hetus and Viprakrushta Hetus. Sannikrushta Hetus are mostly hello.
Hello, doctor.
Sorry. Sannikrushta Hetus are mostly found by the prime doshas like Tridoshas, Vata, Pitta, and Kapha. And Viprakrushta Hetus will be considered as Indriya, Asatmi Indriya, Tasayog, etc. We are secondary to causative. And the next Hetu is Next, Nidan Hetu is Nidan Panchak is Purva Rupa. In Purva Rupa, there are two types mainly explained: Samanya and Vishesh Purva Rupa. Samanya Purva Rupa means which just clarifies the some any kind of disease is coming by, and Vishesh Purva Rupa is she just explains the type of disease which may come, like yawning in Jwara may explain Vata Jwara. Then Charka explained next is Rupa. Rupa means simply Lakshanas of Vyadis. He then mostly Lakshanas are as disease comes by, which does not have many types. Then next is Upashaya. Upashaya has total 6 types, which is Hetu Viparit, Hetu Vyadi Viparit, Hetu Vyadi Viparitarthakari, and Hetu Vyadi Ubhay Viparitarthakari, and last is Hetu Vyadi Ubhay Viparit. These are 6. Then last come is Samprapti. In Ayurveda, Samprapti given most importance in Nidan Panchaka. Samprapti has mainly 5 types, which is Sankhya Samprapti first. Sankhya Samprapti just explains the types, how many types of diseases or how many types of causative. There are examples like 8 types of Jwaras, 5 types of Gulmas, and 7 types of Kushtas. Then Pradhanya Samprapti second, which explains Pradhanyatam means which doshas or which dhatu dushti has mainly parted in diseases like Vataruddha, Pittaruddhatar, and Kafaruddhatam. These are examples. Then third is Vidhi Samprapti. Vidhi Samprapti means any kind of things that parts in diseases or gives types in diseases like Nijana Kantuj types, or types by doshas, or types by Sadhya Sadhyatvas, etc., or types by different. Then fourth is Vikalpa Samprapti. Vikalpa Samprapti means any disease which presents by types of causative doshas or causative dhatukshayas. Every dosha has its own gunas. Not every dosha presents with all types of gunas of itself, like Vata Druksha gun, Kapha Snigdha gun. Then partial guns are comes to front in diseases lakshanas. These are explained by Vikalpa Sampraptis. And last is Kal Samprapti or Kalabala Samprapti, where these Kalabala Samprapti has different explanations by acharyas. Like Charaka explains it as Hitu Pururup Upakshay. By these 4 Nidan Hitus, their combination or their power, their importance explained in Samprapti, in Kalbal Samprapti. If Rupas or Hitus are more given in or more seen in any Vyadi, this is in Kalbal Samprapti, it is more powerful Vyadi. But Madhav Nidana, Kalbal Samprapti explains by time or period or patient's ahar, vihar, lakshanas. That if any Vataj Vyadi is more powerful in Varsha Rutu, or in Varsha Rutu it may be powerful by evening timing, etc. Or Kapaj Vyadi are more powerful in Sheet Kalas. This is Kalabal Samprapti, which may changes by Ahar Bal, Vyadi Bal, or time of day or time of Ahar Kalvera. That's the Nidan Panchaka explained by Charka. I hope I explained it sufficiently. Thank you so much.
Thank you, doctor.
Okay.
So next I would like to invite Dr. Vishal Nagesh.
Hi, good evening everyone. Myself Dr. Vishal Nagesh Kakade, PG Scholarship Jitendra. I am from late Kedar Redekar Ayurvedic Mahavidyalaya, PG Training and Research Center, Gad English Kolhapur. My guide and HOD name Dr. Rudra Pagu sir. My topic is Fishery Nano. Introduction. In today's era of Western lifestyle, IT professionals, and of course the outbreak of COVID-19 pandemic, leading to sedentary work from home, lack of exercise, and unhealthy eating habits, lots of stress causing disturbance in digestive system along with anorectal pathology. Fissure ano is one of them. Fissure ano is an elongated ulcer in the long axis of lower anal canal. Location midline posterior 90% and midline anteriorly. Fissure ano next. Fissure ano etiology, pressure of hard fecal matter on posterior anal tissues during defecation, tearing down of anal wall of ball. An anterior anal fissure is much more common in females and possibly due to damaged pelvic floor and an attenuated perianal body. Multifarious woman fissure can also be due to ischemia. Next, etiology. Some causes of anal fissure are due to inflammatory bowel disease, Crohn's disease, sexually transmitted disease, anal stenosis produced by excessive excision of skin during hemorrhectomy. Pathology occurs in anal canal below the denied line and hence is very painful. Two types of fissure, acute fissure and chronic fissure. Acute fissure, deep tear skin of the skin of anal margin extending to the anal canal, inflammatory induration and edema and edges are absent. Spasms of internal sphincter muscle. Second, chronic fissure, in, inflammatory introduced margin and base consist either scar tissue of the lower border, internal sphincter muscle, sentile file at the lower end of fissure, spasm of internal sphincter muscle, leading to abscess of fistula. Next, internal sphincter muscle fibers in the base of the fissure. Next, clinical feature, more common in women, not common in children. Symptoms, pain during defecation, constipation, bleeding per rectum, mucus discharge in fully established cases. On examination, sentinel file at the lower end of linear ulcer, indurate edges in chronic cases. Differential diagnosis, carcinoma of anal canal, tuberculosis ulcer, which undefined edges, multiple fissure are seen in con disease, homosexual practices, sexual transmitted disease like herpes. Next, treatment. Aim of treatment is often completely relaxation of internal sphincter. The fissure will heal slowly. Conservative treatment, glycerin nitrate ointment, local application produce sufficient relaxation of internal sphincter, laxative, anal dilation using dilators along with the lignocaine ointment, apply locally, operative treatment, lord dilation, lateral and sphincterectomy, dorsal fissurectomy and sphincterectomy. Next, anatomy of rectum. Next, lord anal dilation treatment images. Lateral sphincterectomy, closed method. Next, lateral internal sphincterectomy, open method. Thank you.
Thank you, doctor. Let's say invite Dr. Shamala for the paper presentation on the topic Ayurvedic management of Vyanga, a case study. Dr. Shamala, Sammaiah, are you there? Dr. Shamala, Sammaiah, are you there? Dr. Shamala, are you there? Okay, next I invite Dr. Kadambari Jitendra Jadhav for the paper presentation.
Yes, sir, I'm there.
Okay, doctor, please share the screen, doctor.
Yeah. Sir, actually, I am not able to share. Will you share my screen, please?
Okay, doctor. Just a second.
Yes.
Doctor, please start the session.
Good evening, everyone. Myself, Dr. Kadambari Jadhav. I am pursuing my MD in Komar Bhrutta at College of Ayurveda and Research Center, Nigdi. My guide name is Dr. Madhavi Devdas. Next slide, please. My topic is Balasanskara in Ayurvedic and its reaction to developmental milestones. Introduction. Sanskar are rituals that marks various stages of life. All sanskars give good quality. 16 sanskars are in practice, which should be performed from conception to after death. Many acharyas have told 16 to 40 sanskars, but mainly 16 sanskars are performed. These sanskars are related to proper growth and development of fetus and child. Next slide. Objects and of the sanskars. Sanskars aim in the first instance at material gain to the individual. These are the aims. Build a wakefulness of social status and rights for individuals. Brings about cultural gains. Helps in formulation and developmental of personality. Next slide. There are total 16 number of sanskar and they are as follows. Garbhadhan sanskar, which is conception. Punsanvan sanskar, engendering a male issue. Simantanayan, which is hair parting. Then these three sanskars came under Garbhavastha sanskar. Next is Balyavastha sanskar. Jatakarma, Namakaran, Nishkraman, Upaveshan, Karnavedan sanskar, Annaprashan, Chudakarma, Upanayan, and Vedharamba. Next is Yuvavastha sanskar. In that only two sanskars are explained, Samavartana and Vivaha, and Vruddhavastha sanskar, Vanaprastha, Sannyasa, and Anneschesti. Slide 4, which is Balavastha sanskar. During postnatal period, we do Jatakarma and Namakaran sanskar. During infantile period, we do Nishkraman, Upaveshan, Karnavedana, and Annapashan sanskar. During preschool, Chudakarma sanskar is done, and during school age, Upanayan and Vedharamba sanskar are done. Next slide. Jatakarma sanskar, which is done after cutting the umbilical cord. After birth, feeding should be given, is explained by Acharyas, Charak, and Shushruta. Reflexes are noted in this sanskar, which gives nutritional benefit, feeding benefit, grita benefit, and benefit of gold, which is Suvarna Prashan. Next. Namakaran sanskar, which is practiced on 10th day of life, should begin with Ghosha, means the name which should be begin with Ghosha alphabets, middle word should be with Antansha, and end with Ushma alphabets. Important tool for socialization in society. Next slide. Nishkraman sanskar, performed when child is taken out of home for the first time. Its importance are during birth of baby. It is also good time for check any deformity by Vaidya, as well as clearing any stress or anxiety of parents related to baby. Disappearance of grasping reflexes, 3 to 4 months, placing reflexes, stepping reflexes, everything is noted. 4 month, at the 4 month of age, infant are described as hatching, socially becoming interested in the wider world. According to Acharya Kashyap, the teeth inseminated in fourth mouth are weak, decay early, and are afflicted with many diseases. It should be diseased and weak. Next. Upaveshan Sanskar. According to Kashyap, it should be performed at 6 months. Should not sit for, baby should not sit for a long time. Kashyap has said like that. As per development, child should sit with support and try at 6 months, baby tries to hold things and put in mouth. Next. Karnavedhan Sanskar. There are different views about performing Karna ceremony in Ayurvedic text. According to Shushruth, 6th or 7th month. According to Vagbhat, 6th, 7th, 8th month. There is chapter named Chudakarniya in Kashyap Samhita, but there is no reference available about performing the ceremony because chapter is incomplete from beginning. Karana, Muhurta, and Nakshatra. After reciting auspiciality, the child should be placed. Sir, backslide. ठीक है. Annaprashan Sanskar. Annaprashan Sanskar is performed after 6 months of age, in which diet like liquid form diet is given to the baby with breastfeed. Next slide. Chudakarma Sanskar is shaving of baby's hair for the first time. Upanayan Sanskar, discipline followed by his or her guru, means in school, preschool age 3 to 6 years. Next slide. Next slide. Vedarambha Sanskar, which is performed at school age 6 to 12 years. This Sanskar provides religious, cultural, humanity, self-control, and acceptability in society. Next. Thank you.
Thank you, doctor.
Thank you, doctor.
Okay.
Okay, next I invite Dr.Meenu Swaminathan for the paper presentation.
Namaste, my name is Dr.Meenu Swaminathan. I hereby doing my presentation on the topic pharmaceutical implication of Bhavana Samskara with respect to Lavangadi under the guidance of Dr. R.S. Hirmed sir, B.M. Kanganawadi, Ayurveda Mahavidyalaya. So we know, like in Ayurvedic formulations, we are using different types of samskara. Like samskara is Gunanda Radhanam. That is, we have like Toya, Agni, Sannigarsha, so that we can make different formulations and also it will impart different qualities to the drug. So Bhavana is such a samskara which can be divided into two types, Nibanjana and Nivasana. Nibanjana means soaking, Nibanjana means levitation method, and Nivasana is the soaking method. So Bhavana is a wet trituration process and it is also a size reduction technology. So here a liquid media help in the conversion of the coarse powder to fine particles. So here I am doing an attempt to explore the importance of Bhavana Samskara with the help of Babula Kashaya Bhavana, which is used in a polyherbal formulation called Lavangadi. Lavangadi is told by Dolimbaraja in Vaidya Jivana in case of Kasa Shwasa Vilasa. So Lavangadi is always giving in cases of Pranavaha Srodha Vigaras like Kasa Shwasa Pradishyaya, which is even using in the case of COVID-19. So the materials and methods, the various ingredients of Lavangadi are Lavanga, Marija, Vipidaga, and Kadira, which is using in a powder form, and the Babula Kashaya is we are using here. And these are all collected from the GMB certified Ayurvedic pharmacy, and it is authenticated in the Ayush approved drug testing laboratories. So Lavanga, Marija, Vipidaga are taken in a quantity of 1 part, and Khadira is taking 3 parts. We are powdered, it is in a powdered, and it is giving Bhavana with the Babula Kashaya. The quantity of the Babula Kashaya is not told in the sloga. So we can take the general method of quantity of Babula, that is, and we are preparing the Kashaya as per the general method like 1:8, we are reducing into 1/8. So that is the Babula we are taking in the coarse powder form, and we are adding 16 parts of water and 8 parts we are dividing, and this Kashaya we are using for the Bhavana. So in the first method, we are taking the powder and then we are mixing the powders in fine powder. That is, these powders are passed to 120 mesh and we are mixing with the Babula Kashaya in the Khalva Yandra. And after mixing, we can see the color difference, like dark color is coming. So we are making a pill of 1 gram. That is, the dosage of Lavangadi Vadi is 1 gram. We have to take with muhu, either by chewing or we can take it with the warm water. So while we are preparing, it is in dark brown in color. So after drying, the weight is again reduced to like 584 milligram, like weight reduction has happened. So we can see that by the process of bhavana, the bhavit dravya loses the molecular cohesiveness and the particle size is reduced. And because of the rubbing action, the molecular rubbing action and the pressure applied during the process, it is becoming small. The particles will be rubbed between the rough surface of the mortar and pistil, which led to the breaking down into the smaller particles. And the continuous movement of this pistil on the hard surface help in the reduction size. So the weight of the pistil with the vibratory movement will enhance the molecular size reduction. And also the babula having a gummy nature. So constant bhavana for 1 day make the pills into fine shape. And this babula kashaya always help to reduce the astringent taste and the strong aromatic smell of the lavanga. So we can conclude that in this present study, the effect of bhavana procedure is very compatible to reduce the size of the particle and is without altering the general rule. And also it impart the more efficacy to the formulation by enhancing this natural and imparting new qualities. So the augmenting property of the ingredient generated with bhavana, and there is more possibility of generation of potent synergetic action in between the constituents. So babula kashaya help to form a compact lavangadi vadi with the aid of bhavana process. And these are the various references I have referred. Thank you.
Thank you, Doctor. Next, I invite Dr. Suneera Banga for the paper presentation. Your screen is visible, Doctor. Please continue.
Okay, we were on mode of action. So we were on Charakalpasthana Shloka. Second line was, I was on second line. So Shodram Sajjanam Anu Pravana Bhavad Amashyam Agamya Udan Prananno Agni Vaivatmakva Udharva Bhaga Prabhavad Oshadasya Udharvam Utikshipyate Salil Prithvyatmaktvad Adho Bhag Prabhava Cha Oshadasya Adho Pravartate Ubhaytascha Ubhayat Gunatvata Iti Lakshanodesha, which means drugs used for emesis and purgation are Usna, Tikshna, Sukshma, Vyavayi in nature. By the virtue of their own potency, these drugs reach the heart and circulate through the vessels. Because of their Agnya nature, they liquefy the compact doshas. They separate the adhered doshas located in the gross and suitable channels of the entire body, owing to their Tikshna gun, that is, sharpness attribute. The morbid material, after separation from the channels, moves floating without adhesion in the body, which has been subjected to oleation, that is, lubrication therapy. Just like the honey kept in a pot smeared with the fat, floats without getting adhered to the pot because of its nature to move through subtle channels and to flow. This morbid material reaches the stomach and gets propelled by Udana Vayu. The morbid material gets expelled through the upward tract because of predominance of Agni and Vayu Mahabhutas. Whereas for the purgative drugs, owing to the predominance of Prithvi and Jala Mahabhutas, because of their Prabhava, that is specific actions, they move downwards to expel the morbid material through the downward tract. If both of the attributes are combined, then the material gets expelled both through the upward and the downward tract. So properties of the Virechan Dravya. Gun, Ushna, Tikshna, Sukshma, Vyavai and Vikasi Gun. Pancha Mahabhautik Sangathan, Prithvi and Jal Mahabhauta Pradhan, Ushna Virya, Adhobhaga Prabhava, and action on doshas. Main action is on Pakvashya Ashrit Kapha. Vitiated doshas are expelled through the rectal routes. So, just a moment. Gun and properties of Virechan Dravya. Vyavai Gun. Property of Vyavai Gun is meaning of Vyavai Gun is basically it helps for quick absorption. Vikasi Gun, by Vikasi Gun, it helps for softening and losing of the bond. That is Dhatu Shaithalya Karma is performed by the Vikasi Gun of Virechan Aushadhi. Ushna Gun, Dosha Sanghat, that is compactness is liquefied, Vishandana is achieved. And by Tikshna Gun, Chedan of the dosha is done. By Sukshma Gun, disintegration of endogenic toxins is done. And by Prithvi and Apa means Jala Mahabhut, vitiated doshas are made to pass through anal route and are expelled out of body. So pharmacodynamics of the Virechan Upag. The overall pharmacodynamic of Virechan Upag Dravya is based on the Guna concept only. Acharya Charak has mentioned only the role of Guna in pharmacodynamics of the Virechan Karma. In fact, Gun is a thing that represents a drug. So the selection of a drug should be based on the Gun for Virechan Karma. Acharya Charak has mentioned predominance of Prithvi and Jala Mahabhut drugs for the Virechan Karma. Ras of Virechan Upag Dravyas are chiefly Madhur, Kashai, Amla Ras, which are composition of the same Mahabhut. And are also snigdha in nature. Most of the drugs are Madhur Vipak, similar Bhautik constitution. Other drugs are supportive to the therapy or to avoid complications during the Virechan Karma. So this slide is mode of action of the Virechan Karma. Administration of Aushadhi, then it is absorbed through due to its virya, and then it's circulated all over its body through macro and micro channels, and due to the gun like Vaivai, Ushna, Tikshna, Sukshma and Anupravana Bhavat. Okay. And then by Prabhav, Prithvi and Jal constitution, the presence of Prithvi and Jal, Mahabhut, the Sar, and the presence of the Saragun, Virechan is done, or the defecation of the doshas is done from the body, or the detoxification is done from the body. Now, the next slide we are able to view here is Anuloman drugs act on ascending colon, like Haritaki. Vedan drugs such as Katuki acts on the sigmoid colon. Sransan drugs like Casia fistula acts on body of stomach, and Rachan drugs act on the descending colon. So next we'll be seeing the transit of pharmaceuticals in gastrointestinal tract. Esophagus, in esophagus the transit time is of 10 to 14 seconds of any drug, any Aushadhi. In stomach, the transit time is it is variable depends upon the dosage form and the fed or the faster state of the stomach. In the small intestine, the transit time is relatively constant. It can be for 3 hours. This contrasts with the stomach because it doesn't, there is no dosage forms for it. Large intestine or colon, the transit time is long and varies upon dosage form, diet, eating, etc. So the next slide, we see how a drug, if it is administered through the oral route, it is metabolized by the luminal enzymes, then by the bacterial enzymes, then by the gut wall enzymes, and then by the bacterial enzymes, and then it is passed by the liver for the first pass hepatic metabolism. So next, physiology of the Virechan, that is defecation reflex, mass peristaltic movement push fecal matter from the sigmoid colon from the rectum. The resulting distension of the rectal wall stimulates stretch receptor, initiates a defecation reflex that empties the rectum. The defecation reflex occurs as follows. In response to the distension of the wall, the receptors send sensory nerve impulse to the sacral spinal motor impulse from the cord travel along the parasympathetic nerves, descending colon, sigmoid colon, rectum, and anus. The resulting contraction of the longitudinal rectal muscles shortens rectum, thereby increasing the pressure within it. This pressure, along with the voluntary contractions of the diaphragm and the abdominal muscles, plus parasympathetic stimulation, opens the internal sphincter and defecation occurs and the feces are expelled through it. So moving on to the next slide, which is this slide corresponds with, to my previous slide only. It is just a visual, just a representation of my previous slide, that is defecation reflex. So moving on to next slide, mechanism of purgation. There are certain groups like anthraquinone, they act on large intestine, they take 6 to 8 hours of action of time for action, and they stimulate large intestine and also water and water absorption in colon. Irritant oils, they act on small intestine, they take 2 to 3 hours, and it is chemically triglyceride of ricinoleic acid and unsaturated hydroxy fatty acid. It is irritant. Some other miscellaneous drug that irritant stimulates in large intestine for they take 6 to 8 hours. Osmotic drugs, they act by osmosis and they act on small and large both intestines, and they take 3 to 6 hours for their action because watery evacuation. And also, therefore, patients are advised to take post-lunch or post-meals. Bulk, the drugs which comes under bulk category, they take 12 to 36 hours and purely by physical property of forming the bulk. So, Finally, the conclusion of today's presentation is Virechan Karma is safe and effective treatment modality for various disorders and can be effectively used for among all the classes of patient. It specifies tridosha, specially pitta dosha, and thus effective in multiple conditions. By knowing probable mode of action and pharmacodynamics of Virechan Dravya, one should treat that disease properly. So thank you. I'm done.
Thank you, doctor. Next, I would like to invite Dr. Kiran Dharma.
Topic of my paper presentation is management of trigger finger with Agni Karma, a case study. Myself, Dr. Kiran Wagh from Shalya Tantra Department of CSMSS Ayurved Mahavidyalaya, Kanchanwadi, Aurangabad. Abstract. Trigger finger, also known as tenosing tenosynovitis, is a condition in which there is obstacle to voluntary flexion and extension of the finger. It is caused due to inflammation and hypertrophy of the retinacular sheath, which progressively restricts the motion of flexure tendons. According to modern treatment view, includes splinting, corticosteroids, injection, or surgical release. According to Ayurveda, trigger finger can be correlated with Snayugat Vat in Sushrut Samhita. Clinical features of this Snayugat Vat described by Acharya Sushrut are Stambha, Kampa, Shula, Akshepa. He advised Agni Karma as specific line of treatment in disease of Snayu, Asti, Sandhi. This is the case of trigger finger managed by Agni Karma. This procedure was administered weekly once for 4 weeks, giving a complete relief from symptoms. Introduction. Ayurveda, the science of life, is based on the time-tested observations and medical experiences with preventive, promotive, and curative aspects of life. Shalya Tantra is one of the most important branch of Ayurveda, which has its own originality and authenticity. Sushrut Samhita is only text in surgical practice, enriched with basic surgical techniques and parasurgical measures. Acharya Sushrut mentioned different methods of management of disease such as Veshaja, Shastra Karma, Kshara Karma, and Agni Karma. Agni Karma is mentioned with utmost importance among Anushastra Karmas because of its simple technique and optimum result. Trigger finger is a condition characterized by painful locking of the digit on flexion and extension. This is caused by inflammation and subsequent narrowing of the A1 pulley, which causes pain, clicking, catching, and loss of motion of affected finger. According to Ayurveda, it is correlated with Snayugat Vat. Agni Karma is a supreme mode of parasurgical management. As a pioneer of Shalya Tantra, Acharya Sushrut gives a well-known Agni Karma Chikitsa for Asti Sandhi Snayugata Vikar. Hence, considering above facts, in the present case study, management of trigger finger done by Agni Karma therapy. Aim of this study is management of trigger finger with Agni Karma, and objective of the this case study is to assess the efficacy of Agni Karma in the management of trigger finger. Case report. A 42-year-old female patient presented with following complaints: clicking of her right middle finger, difficulty in folding of middle finger of right hand, no history of any trauma to right hand. For the above complaints, she took analgesics, anti-inflammatory, steroids also, but there was no satisfactory relief through the above drugs. Routine blood investigations and X-ray examinations of affected finger were done, and all investigations found to be normal. After final diagnosis of trigger finger, on the basis of above complaints, and patient herself was willing for Agni Karma therapy. Material and methods. Purva Karma. A written informed consent was obtained from patient. Instruments for this Agni Karma are sterile cotton gauze, Agni Karma Shalaka, Gastro and Datyadi Grit. Pradhan Karma. Agni Karma was done over the tender points over middle finger of right hand at multiple sites and metacarpopharyngeal joints. Red hot Panchadhatu Shalaka was used for Bindu Dahan Vishesh, and 8 to 10 Samyak Dagdha Vrana was made. It is noted that proper space should be kept in 2 Samyak Dagdha. Datyadi Grit should be applied on Samyak Dagdha to get relief from burning sensation. After that, in Paschat Karma, patient was advised to apply Datyadi Grit over burn site for 2 days. The procedure was repeated weekly once for 4 consecutive weeks. The result of this Agni Karma in trigger finger is that the patient got complete relief of symptoms in period of 4 weeks, and thereafter no recurrence was noted during the follow-up period of 1 month. Discussion: the patient got complete relief of symptoms in a period of 4 weeks, and thereafter no recurrence was noted. Hence, Agni Karma can be prescribed as an effective procedure in the management of trigger finger. Probable mode of action of Agni Karma: in the presence of Agni Karma, in the process of Agni Karma, therapeutic heat transferring to Tvaka Dhatu and means skin and gradually to deeper structures renders relief of symptoms such as Shoth and Shul. Agni Karma acts as a counter irritant which relieves pain. Heat is Ushna, Tikshna, Sukshma, Vyavai and Vikasi in Gun, which is helpful to break the Kafanupandha, thus reducing Shoth, which allows the sheath to enter in tendon while clenching and extension. Also, Vata get neutralized so that pain is relieved. And the conclusion of this study is Agni Karma is an OPD procedure. From above case study, it is concluded that Agni Karma procedure proves to be easy, safe, economical, and invasive procedure to reduce the trigger finger. Agni Karma therapy is helpful in the management of local pathological diseases. References. Thank you. I'm done with my presentation, sir.
Thank you,
Thank you, Doctor.
Yes, thank you.
This is a paper presentation by Dr. Vishal D Mori.
Good afternoon, all of you. Myself, Dr. Vishal Mori from w.s.r Mahavidyalayam, Nadia. My today's presentation topic is Ayurvedic management of trigeminal neuralgia, a case study. Here are the contents of the presentation. Abstract. Trigeminal neuralgia is a facial pain disorder characterized by recurrent paroxysmal of severe unilateral pain disturbing on one or more branches of trigeminal nerve. The nature of disease history is commonly assumed by the progressive, and the prognosis of disease is to be poor with slow deterioration of over the time. However, the finding of the disease is confirmed the progressive nature of the disease. This is also called a suicide disease. A large population is affected by the disease. This is the condition in which there is a sudden severe unilateral paroxysmal exudating pain initiated by touching and triggering the zone. Keywords: trigeminal neuralgia, Ardha-Vedak, Ayurveda, and Agni Karma and Basti Chikitsa. Purpose of the study is it is the contemporary correlation, and then it is known upside down in the treatment, such as microvascular decompression. It doesn't have any high margin of success rate. In incidence of 4 to 5 cases among 1 lakh of the population, it is nearly twice as common in women than men, increasing around the 1 patient among the 100 patients older than 75 years of age. Ayurvedic management had proven significant relief in symptoms and found reduced recurrence. These approaches are helpful in such disease condition. With the changing demand awareness among the states, the role of Ayurveda is an emerging reality. Aim and objective to study the Hetu, Lakshan, Samuchay and of trigeminal neuralgia and find out the efficacy of treatment which was given in the disease. Material and method was collected from Brihatraya, Laghutraya, research articles, books, and national database. Here we can forward to the second part of the study is case study. A 40-year male patient from Baroda, Gujarat with occupation of tailor with chief complaint of paroxysms of exudating pain on the right side of the face, headache, and constipation. Brief history: a 76-year-old male patient approached to our hospital with the complaint of severe exudating unilateral pain on the right side of the face since last 9 months. The patient 6 months back started suffering from pain which was twitching over the right temporal region, eyebrows, cheeks, and jaw region. The pain was unilateral on the right side and it was brief, but with 10 to 12 episodes of day which remains for 2 or 3 minutes, with decreasing the jaw movement. The pain was aggravated by chewing gum, brushing the teeth, blowing the air. Thus, the patient consulted an ENT surgeon and diagnosed with trigeminal neuralgia and started medication for that. For 4 months, he has taken medication but not having any kind of significant relief in pain, and patient was advised further for the surgery. So he approached our OPD and patient was admitted and given Virachan Karma, Basti Chikitsa, Agni Karma Chikitsa and other oral Ayurvedic treatment. Here we can see in timeline 1st January, he started the pain. During the whole January, the pain was increasing gradually on the right side of the face. On 29th of Jan, he was diagnosed with trigeminal neuralgia with confirmed diagnosis of MRI. On 30th Jan to 17th April, he has taken medication but not having any kind of relief. On the 18th April, he was admitted in our hospital and given treatment. Oral treatment and Agni Karma treatment. After the 1 month, on 16th May, he was discharged and complete relief from all the symptoms. A picture is worth 1,000 of words. The confirmed diagnosis of MRI of brain, with there is a finding of suggestive bilateral trigeminal neurovascular conflict. Here is the Sweet Pariksha. On physical examination, patient was fully conscious and well oriented with time, place, and person. All sensory and motor functions are normal. All senses were intact. Here we can see in the treatment schedule, from the very first day, he was given Snepan followed by twice a day, which is increasing in manner, and Agni Karma was given every day, twice a day. After the Samyak Shuddhi Lakshan on 24th for month, we have done Vyanga and Svedana for 2 days, and then after on the 3rd day we have given Videchan Karma with air and snake 50 ml and Deen Dayal Churna 5 gram with Anupana of the Rakshakvat. After Samyak Virechana, Sansarjan was given from very first May to 16th May. Patient was given Niru Basti, Dashmul Kwatin 320 ml and Matra Basti 40 ml with Balatel alternatively. Nasya with Balatel 80 drops each nostril was given. Tribhuvan Kirti Rasa 3 tablet 3 times was given. Pathyadikwat 40 ml twice a day was given. Empty stomach. Patients monitoring by the VAS scale. Here we can see the 2 phases of pain in morning and evening pain. First week it was morning pain was 25%, evening pain was 50% decrease. On the 4th week, the completion of treatment, 50% of relief from all the symptoms. On the second follow-up, after 2 months, patient had complete relief from all the episodes till the date. Here we can see on the clinical feature pain was 10, VAS score, which are decreased up to 4. And after the 6 months of follow-up, there is no pain. Here we are at TMJ stiffness, we have found the 5, the score, and after treatment, the score is 0. Restricted jaw movement was 8. Before the treatment, it is gradually decreased up to 0. Pain around the eye, which was 7, which was decreased up to 0. Headache was there during the treatment, but as the treatment passes, the headache was relieved. Constipation was found on the very first day of treatment. After Virechana, his wall frequency become normal. Here we can see Pathyadikwas is its own antipyretic, hepatoprotetic, and anti-tumor property. Specifically, anti-inflammatory properties. He has Amalki, Guduchi, and Bunimba, which has anti-inflammatory properties. And in Shirorogas, the effectiveness of Pathyadikwas were found, and Pathyadikwas is Tridoshhara, mainly Kapha Pittahara, which is useful in this kind of condition. Tribhuvan Kirti Rasa, it is Vat Kapha Nashak Aushadhi. It has Vish Aushadhis like Vatsnav, Shruddhi Hingula, which in this condition, Ashu and Vyavai Gun Aushadh will give immense result in this kind of condition. Niru Basti, Dashmul Kas was selected because his aggravation of Vata. Dashmul is the best Vata Shamak Aushadha and it is anti-inflammatory, which relieves the pain and inflammation, and localized Vat. Basti Chikitsa is very much useful. Matra Basti 40 ml Balatvel is given to reduce the dryness in the body and increase the Snigdha Guna and increase the bulk of the patient. Chavanprash Avle, it is a immunomodulator, will work as in treatment and also as work as a Bruhan Chikitsa. Agni Karma Chikitsa with modified Ark Patra, Swedan and Spirit Soap was given on the endings of nerves and the scalp region during the whole treatment. Patient was advised to have Lagu Supachi Ahar, Boduk, Snigdha Ahar, Chavanprash Avle, and avoid to cold heat and SE exposure. Patient was advised to not take excessive spicy food, dietary items, packet food items, packet juice, and cold drinks, etc. Cold things, and cover the head with the cold wind and other AC environment. Discussion: Ayurvedic management in trigeminal neuralgia may give hope for thousands of patients. This case report demonstrates the treatment of TGN completely with oral Ayurvedic medication. No any surgical intervention was given during this treatment. Thus, by the above mentioned case report, we can came to the conclusion that Ayurvedic line of treatment for Anantavata, trigeminal neuralgia, is effective, and further studies should be carried out in the field that patient get immense result in this kind of disease condition. Here we can conclude that on this case of study, patients are more follow-up and patients are required for the studies. It is hope for the patient that many patients will get relief from this condition. In this present case, Vathara and Bruhan Chikitsa was given. Patient get 80% of relief with all the symptoms. Oral medication and Panchkarma process are having significant role. Hence, there is a need to implant Ayurvedic medicine in large sample of disease to draw the concerned conclusion. Here's the patient's comment: when I come to hospital, I have severe pain on the left side, right side of the body, which is decreased after I am admitting here. Allopathic doctor advised him to take continuous painkillers, and in further condition, he was advised for surgery. After admitting here, his pain was completely relieved. No allopathy medication was taken by me, and he is relief from Agni Karma and oral Ayurvedic treatment. I am very much thankful to J.S. Ayurveda Mahavidyalaya and all my gurus. Here are the references. Thank you.
Thank you, Dr. Vishal, for this paper presentation.
So next, I invite Dr. Tom Thomas for the paper presentation. I invite Dr. Tom Thomas for the paper presentation.
Dr. Tom Thomas, please unmute, doctor.
Hello.
Hello. Is it Dr. Tom Thomas?
Yes, sir. Hello.
Hello, doctor. Please share the screen, doctor.
Okay, 1 second. Sir, it's possible to see, sir. Hello.
Dr. Tom, your screen is visible.
Hello.
Yes, you are audible, doctor.
Sir, is it possible to see first of all? Can you
Yes,
see,
your
sir?
screen is visible.
Hello. Yes.
Doctor, your screen is visible.
Wait, one second. Actually,
Hello,
now
Dr. Tom Thomas,
you
can
can
you
see,
hear me?
ma'am.
Yes, doctor. Your screen is visible, doctor. Please start the
Hello.
session.
Ma'am. Yes,
Doctor,
yes. Now I can.
your screen is visible.
If is visible, right?
Yes,
Okay,
doctor. Visible.
okay. 1 second, 1 second. Okay. Okay, now I think you can see.
Yes, doctor.
Okay. Can you see, ma'am?
Yes, doctor. Your screen is visible, doctor.
Sir, can you see my video actually? Sir, can you see my video actually? Hello.
Yes, doctor. Visible, doctor. Visible.
And my audio is audible, sir.
You're audible, but some breaking in some times. No problem, doctor. Please continue, doctor.
Breaking in some time. Okay. Okay, sir, here Hello. Hello, sir. You
Yes,
can hear me,
doctor.
right?
Yes,
Yes,
doctor.
Sir,
we can hear you,
do
doctor.
one thing. I will join in my phone only. I will join in my phone only. Okay. Or you can hear me.
Doctor, your
This-
voice is breaking. Connect with other device. Try to connect with other device.
You can hear me in this, or I should join on my phone, sir.
Yes,
Yeah,
doctor.
yeah. I
You're
will
audible.
connect
Audible.
with other device. That is 1 second.
Okay, okay.
I will connect. Hello, sir.
Yes, doctor. Now your voice is clear, doctor.
No, voice is clear, I think. And whether the PPT is sharing?
No, doctor.
No,
Not visible.
doctor.
Not from my, that is from lab. It is seen. Can you just see?
No, it's not visible, doctor.
Ma'am, can you just share my PPT? I think.
Okay, doctor. I will share for you. I'll share for you.
Sure,
Doctor.
Yeah,
1 second.
that's better. That's better, I think, because lab is not connecting and network is low.
Doctor, please start the session, doctor.
Okay. I think you can hear, right?
Yes, doctor. Yes, please continue, doctor.
Okay. Thank you. So, my video is you can see, I think, right, sir?
Yes, doctor.
Yes,
Yes.
doctor.
Okay, fine. So, Sri Gurubhyo Namaha. Today, I am going to deal with a new topic which I have found from I found it on some topic was seen from one seminar presentation, actually, from a famous doctor. He has done with the maggot therapy in the field of healing of wounds, actually. So why I choose this topic is the main aim of this topic is that many of our doctors or many physicians, not only allopathy, other than doctors, are using this. Actually, the management of wound healing ulcer was a difficult topic. So if we want to have some wound in this, we have this gangrenous part as well as this cellulitis part is this gangrenous part and normal part. If any surgeon will do the surgery from the normal part, they can't protect the gangrenous part, I think. So what by maggot therapy, what we can do is we can save this gangrenous part also if it is affected here. But normal doctors cannot they cannot do such kind of things because they want to amputate from this basic part. So that is the purpose while I use here maggot therapy from this topic. So let's move on. Sir, next slide. Sir, next slide. Okay, introduction part. So here we are seeing about maggot therapy in different cases, and the larvae of the green bottle fly, that is Lucilia sericata, are used in this MDT, and it is mainly used for wound healing and debridement for necrotic tissue. And the mechanical debridement is done with the help of the mouth of hooks, and they may have a secrete a mixture of proteolytic enzyme. With the help of these enzymes, actually this procedure is done. Sir, next slide. And actually, from the introduction part, we can see the most commonly used is the insect larva. That is from the family Californidae. And the maggot is not a technical term and it should not be taken as such because many standard books have entomology and it does not appear in any index at all. Sir, next slide. Sir, next slide. So we can see the history of maggot therapy from 2000 BC till now. We can see maggot therapy was there present. It is maggot. Then according to FDA regulation, it came and finally it was till now. Sir, next slide. So we can see from these ancient times, I will generally come to a point. Just a brief, William S. Baer was first introduced in 1930. Before that, only ancient times only this was done. Then again the antibiotic came. Then again maggot came. I will tell you detail next slide. And this in the early description, it was already told in the Bible, which contains citations of meiosis. And anthropologists suggest Mayans have utilized this maggot. And Napoleon surgeon observed benefits of larvae. Surgeon Zacharias as first therapeutically used this maggot. Sir, next slide. And he was the person first who introduced during the wartime to the soldiers to help the treatment. He has introduced. Sir, next slide. So he observed what the thing is in dead tissue and decaying tissue. Only the maggots survive in the decaying tissue, not on the live tissue. Sir, next slide. So he used in types of soldiers to treat this, and he got some success result in this. Sir, next slide. So after that, what happened? Maggots was very loved by the tribal people and even Northern Myanmar people and the Mayans of the Central America. That I was told before in the previous slide. Sir, next slide. And then came our John Forey Zacharias. He was observed during the wartime. Next slide. During the war side, he was looking towards this thing. And sir, next slide. Then he can observe that these maggots are only existing on this dead tissue, and it will only it will give enzymes and produce, and actually it will act like we will think that it was eating the wound, and the wound gets healed by many of the persons at that time. Next slide. So he find it eminent satisfaction with the help of this maggot. Next slide, sir. And at that time, this Louis Pasteur and this Robert Koch was there. They told, next slide, sir. So they told nothing. This thing is, we don't need maggots. Why these maggots? Sir, next slide. And that time the Alexander Fleming came, he first invented maggots. He first invented penicillin. Sir, next slide. So he threw out this maggot. We don't need this maggot. I will invent penicillin. Sir, next slide. And the penicillin was brought, and at that time, sir, during invention of penicillin came into existence, and many of the diseases was cured by penicillin. Sir, next slide. At that time, generated a virus. Sir, next slide. And the virus is methicillin resistant Staphylococcus aureus, or MRSA. Sir, next slide. And MRSA came into existence at that time. Nothing can do with this penicillin. So then again, our maggots came into back with a boom. So next slide. So we have observed many things that in maggots will only eat the dead tissue. Next slide. That was seen in this slide. Next slide, you can see the maggot will eat only the dead tissue. So next slide. Next. So they eat the bacteria entirely, such as MRSA. Sir, again, that is amazing actually, because it was gone, again it was introduced. And finally, sir, next slide. It was used all throughout the air. And where we see this was classical reference was told in Susruta Samhita Chikilsasthana Arbuda Grandhi chapter. It was told that Nishvanya Kulatta Kalke Mas Pragait There Mastu Yutta Lebam Vidyat Yadatra Murchandi Munchan Mashigasta Alpa Vashiste Krimi Fashyade Chaliget Chatot Agni Trabutam Tamrasi Sapatai Samoveshtam Tadaya Server. So what this means was actually maggot was seen with the help of, first of all, we take some nishpa along with the meat and water of a curd. It was made into a paste and we applied on the patient on tumor side. So the flies will swarm it and they will eat, and the crimi and the maggot was formed and developed there and eat away all the tumor. And only small remnants were then burned by this fire. And if a small empty space is there, when it was encircled with the help of tamra and copper, lead, and iron, actually. So next slide. And the definition came to the application of the maggot in the medicinal to heart to heal chronic wounds, to promote and healing, prevent the infection. And sometimes you have a doubt that why we will put this, it will mix with blood. Actually, it won't mix with blood because it will only exist in the bad tissue, that is a dead tissue. And the larvae will have a time period. Next slide. And larvae will have a specific time period, and we will change the larvae at each and every time. And whether this have any, the next slide. So the 2 days. Slide. So from there we will get these maggots. Actually, maggots was cultivated in India in Sridhara Medical Institute. And the method of larval, how we apply this, first we are using a larva within a dressing, which is called the bio bag. And they come in varying inside the bio bag throughout the treatment period. And we can use two methods, that is which was sealed and which was free, that is directly introduced into the food. So next slide. Okay, so what is the deliberate utilization of this live medical grade fly larvae? You must think that we are using only medicated and which was actually used only medical live fly larvae. So we can't take any larvae which we were seen outside our corridor somewhere which was infected, like that we want to. And the introduction of live disinfected maggot fly into the non-healing skin and soft tissue wound of a human or other animal for the purpose of cleaning out of necrotic tissue without a wound. That is the procedure of this maggot therapy. So next slide. So how we can apply this maggot contained in a cage, like dressing over the wound for 2 days, and may either move freely in the cage or be contained within a sealing pouch. So dressing must be kept air permeable as maggots are aerobic. And these maggots are often satiated within the 48 hours and start to leave the wound at a considerable larger size. Multiple the 2 days course treatment may be administered to reproduce. I have already told they cannot reproduce because they are not mature. Some stuff from earlier only, but we came into a proof that it was having many research works in it. Complex hand injury, it was complicated by mycotic infection. 2015 followed by negative pressure therapy allowed progressive healing. Sir, diabetic foot ulcers colonized by multi-drug resistant bacteria in 2015 Brazil, and in US in 1995. Actually, it was seen in chronic bilateral plant foot ulcer. And we can see the mechanism of action. That is, we can see the debrided wound by eating necrotic tissue leaving behind the healthy tissue, disinfected the wound by antimicrobial secretion, stimulate the wound healing. Sir, next slide. Sir, next slide. So, sir, next slide, conclusion slide. I think almost a year of whether we so risks are there in case of patient's fear, and actually the results are better, and the MDT, that is very alternative therapy that has been used for the recent research is into the cellular mechanism on the action of MDT therapies in the future that have the potential to revolutionize the wound healing. Sir, next slide. Sir, next slide. Okay, I think I came to in conclusion, and thank you very much for giving an opportunity to present in the Tarangini National Seminar presentation. And any more questions?
Thank you, Dr. Tom. It was a well-explained presentation.
I think I was lagging because of some net issues. Sorry. Okay. Okay, thank you very much. Okay, any inquiries you can ask. I'm actually interested. And any doubt or any clearance you can do. I don't know, I have exceeded my time limit, first of all, because of this net issue. Okay, I think you can hear, right?
Thank you, Doctor. Thank you, Dr. Tom Thomas.
Okay,
Thank you,
thank
Doctor.
you. Thank you.
So next, I would like to invite Dr.Bhagyashri Bhaurao. I invite Dr.
Hello, Dr. Bhagyashri, are you there? Okay. Next, I invite Dr. Pooja for the paper presentation. Dr. Pooja Punlik Chadange for the paper presentation. Dr. Pooja,
Yes,
please unmute, Doctor.
Yes, sir.
Okay, Doctor, please share the screen.
सर शेयर नहीं हो रही, आप शेयर कर सकते हैं? हेलो.
Hello, Doctor. You have any problem with screen sharing, Doctor?
हाँ, स्क्रीन शेयर करो.
Okay, Doctor. I will share for you. Just a moment, Doctor.
ये ओपन करूँगा.
Doctor, please start the session, Doctor.
Yes, sir. Today's my topic is Ayurvedic management of blepharitis with Haritra Ashtotan. I am a second year scholar, PG scholar in Department of Shalakya Tantra, PMT Ayurvedic College of Shevgaon. Abstract and background. Nowadays, due to industrialization, huge amount of air pollution takes place by chemical dust, chemical smoke, dust particle, overuse of cosmetics, unhygienic condition, long-standing dandruff, etc., leads to various type of eye disorders. Blepharitis is a common disease of eyelid margin in day-to-day life. It is compared to Klinavartma by Ayurvedic. Ashtotan with Haridra Kwat is useful in this condition.
कौन? पापा कमजोर को छोड़ो.
Method. A 32-year female patients come with itching, redness, swollen of lid margin. She was successfully treated with Haridra Kwat Ashtotan. Discussion. The drug Haridra Kwat is used in patient of blepharitis in the form of Ashtotan. Next slide. Keywords: blepharitis, Klinavartma, Ashtotan, Haridra Kwat. Next. Introduction. Blepharitis is an ophthalmic condition characterized by inflammation of lid margin. It can be acute or chronic, with chronic being more common form. It can be further defined by location of the problem, anterior versus posterior. It is usually present with the recurrent symptom that may vary over time and involve with both eye. Blepharitis is a clinical diagnosis based on irritation of lid margin with crusting of lashes. The main treatment of blepharitis is good eyelids hygiene and elimination of triggers with the reduced symptoms. Topical antibiotic may be prescribed. The goal of treatment is reduce symptom because most blepharitis is a chronic. Patient needs to maintain a good hygiene to prevent the recurrence. Aim to study the role of Haridra Kvatashtotan in blepharitis management. Etiology: all age group, poor hygiene condition, exposure to smoke and dust, refractive error secondary to sty, overuse of cosmetics. Symptom: itching, redness, swollen of lid margin, watering and photophobia. Materials and method: the drug of Haridra Kvat is used patient of blepharitis in the form of ashtotan. Drug: Haridra, Latin name Curcuma longa, local name haldi, family Zinziberaceae, rasa tikta आणि मधुरा, वीर्य उष्ण, विपाक कटु, कर्म कंडुग्न, क्षोतहर, चक्षुष, त्रिदोषहर, कफग्न, प्रयोजंग कांड. Result: Haridra Kvat Ashtotan, good result in management of simple blepharitis. Next slide. Conclusion: blepharitis is a common lid margin disorder caused by overuse of cosmetic, unhygienic condition, etc., and secondary streptococcal and parasitic agent. This study aims to reduce sign and symptom and recurrence of blepharitis by ashtotan of Haridra Kvat. Haridra is a kandugna, shotahar, and chakshushna in property, and Haridra acts in antiseptic. References. Thank you.
Thank you, doctor.
So next, I would like to invite Dr. Pranali Prabhakar. I invite Dr. Pranali.
Hello. Yes, am I audible?
Yes, Doctor, audible. Please share the screen, doctor.
Hello.
The doctor, your screen is visible. Please start the session.
My today's topic is treatment of Arma according to Ayurveda. My name is Dr. Pranali Mirkar. I am second year scholar PG, PMT's Ayurveda College, Shivgaon. My guide is Dr. Mahesh Joshi. I am second year PG scholar in Sharakya Tantra department. Today I will talk about treatment of Arma according to Ayurveda. In Ayurveda Samhita, Arma is described as Shuklagat Netra Rog. But what is Arma? Arma is Maunsal Vriddhi, developing either from Kaninika or Apanga Sandhi. It progresses towards Krishna Mandal. Arma can also be correlated with pterygium according to modern science. It is definition of Arma is Prastari Pratitarma Shukla Bhage Vistirne Tanu Rudhira Prabham Sanilam. In Ayurveda Samhitas, it is described as Chedan Sadhya Vyadhi. There are 5 types of Arma: Prastari Arma, Shukla Arma, Kshataj Arma, Adhimansa Arma, Snayu Arma. Why I am talking about Arma today? Because there are many patients in tropical country like ours. Many patients are there of Arma. So I'll talk about treatment of Arma. Arma is abnormal growth in Shukla Mandal and it should be removed. But before surgical treatment, we should also try medicines, that is non-surgical treatment. Lekhan Sadhya and Chedan Sadhya. Treatment of Arma is classified as Lekhan Sadhya and Chedan Sadhya. So non-surgical treatment includes Nasya Karma, fine powder of equal quantity of Krishna Loha, Tamra, Shankha, Pravar, Saindhav, Lavan, Samudra Fen, Kasis, It is pasted with watery portion of curds, dadhimastu. This is applied over arma or used for nastya karma. Oral drugs are vasakadikvat, brihat vasakadikvat, mahatrifaladi grut or lohadi guggur. Lepan. Marichadi lep, the fine powder of marich and bibitak pasted with fresh turmeric juice should be applied over arma and regularly clear with extra growth. Anjan and Putpak, Krishnadi Putpak is used. And for surgical treatment, there is Purva Karma, Pradhan Karma, and Paschat Karma. So, according to our Sanhitas, Purva Karma includes patient should be given oily food and ghee before surgery. Position of patient should be patient lie down in the bed where head is slightly in downward position or sit comfortably. Eyes should be given fomentation with cotton cloth or gauze dipped in warm water. Pradhan Karma. Patient is asked to look laterally. Hence, mostly common type of arma is mostly nasal pterygium, we call it. Arma is lifted with hook, badi shantra. Arma lifting. Arma is held with pair of forceps, which is muchundi yantra or stay suture and elevated. Lead should be held apart tightly. As there is risk of being hurt by instrument. Arma, thus weakened and suspended by these three instruments, should be dissected from all sides with a sharp circular knife, mandalagram. It should be removed after freed from all the sides, sparing the canthus. Paschat Karma. Paschat Karma includes Pratisaran, Parishek, Vranabandhan, and Sita Pradeha. Pratisaran should be of with powders of Yavanakla Trikatu, Saindhav Lavan. Parishek should be of, the wound should be cleaned with sterilized gauze and honey, washed with cold water and lukewarm ghee. And it should be patched, that is Vranabandhan. Bandaging should be done after applying the honey and ghee. Sita Pradeha, the cooling medicaments like Satadhatu Bhrut should be applied to head and sole of the feet. This is treatment of arma according to Ayurveda. In pterygium, same treatment is given, but nowadays we use conjunctival autograph. That is same treatment according to Ayurveda, but just addition of conjunctival autograph. Management of complications. If there are complications like swelling, for swelling we use Dhoopana, Nasya Karma, and Sira Visravan should be done. If there is excessive discharge or redness, Nasya Karma is helpful. If there is damage during surgery, the Krishna Mandal scarring is done, it should be treated with Savran Shukla. If arma is remaining, application of Lekhananjan should be done. Sometimes the arma is normally 70% arma is dissected and 30% is left. If there is still remaining and it is growing, then Lekhananjan should be done. Thank you.
Thank you, doctor. Now, I invite Dr. Dhanashree Rajendra. I invite Dr. Dhanashree Rajendra for the paper presentation.
Hello, ma'am. I'm not able to share my screen. Am I audible?
Yes, doctor, you are audible. Wait a second.
Dr. Dhanashree, I will share for you, doctor.
Yes, please.
Dr. Dhanashree Rajendra, please start the session, doctor.
Okay. Thank you, sir. Good evening, everyone. I am Dr. Dhanashree Jadhav, second year PG in Shamala. Topic for today is role of Vyanga in Netra Roga. My guide is Dr. Mahesh Joshi. Next slide, please. The aim of Ayurveda is Swasthasya Swasthya Rakshanam Aturasya Vikar Prashamanam. To maintain Swasthya or to fulfill the aim, Ayurveda has mentioned Dinacharya, Rutucharya, etc. Padabhyanga, that is foot massage, is one of the parts of dinacharya. Due to changing lifestyle and excessive use of computer, TV, mobile screen, visual acuity worsens and produces various netra rogas. And for this, people mostly use modern medicine. But in Ayurveda, with the help of Padabhyanga, Drishti Prasadna effect occurs, which can help in prevention or treatment of various netra rogas. Padabhyanga has also been considered one among Chakshishya Varga. Hence, here an attempt has been made to compile the information and benefits of Padabhyanga. Next slide. In Ayurveda, Padabhyanga or foot massage is considered the mother of all. It is your feet that connect the being in you to the earth that you belong to. Pada in Sanskrit means foot and Abhyanga means use of herbal oils. It is believed that our body and soul are connected and embodied in our feet. Pada or foot has been given most importance in Indian customs, traditions, and medicine. In fact, in Ayurveda, Pada is considered as an important motor organ, Karmendriya. Our feet are more than just an essential part of our body. Ayurvedic texts explain that human body is in the form of inverted trees, wherein roots lie at the top and the branches are all attached to the trunk, directed downwards. Just as the trees are nurtured at their roots, but fruits are obtained in their branches, the human body too, if taken good care, will obtain its fruits in the branches. Hence, while enjoying the fruits in the form of daily activities that we do with our hands and feet, it is according to Yoga Ratnakar, the person who massages his or her feet regularly before sleeping will never be deceased. Next slide. Definition. Sneha dravya on the foot and region followed by massage is known as Padabhyanga. It is a calming and soothing therapy. Next slide. Here are some of the benefits of Padabhyanga. It relieves stiffness, dryness, and numbness of the leg and foot, offers sturdiness and stability to the foot and limbs. Drishti Prasadna hence promotes healthy eyesight and relieves eye strain. Prevents or cures sciatica through enhanced blood circulation and improved peripheral circulation. It prevents cracks in the foot and leaves the feet looking healthier and attractive. Padabhyanga reduces stress, calms the mind, and allows a rejuvenated mind and body. Relaxes and revitalizes the central nervous system. It removes fatigue from lower limbs and improves quality of sleep. It activates metabolism, cures headaches, and prevents onset of degeneration. To calm and maintain the Vata dosha, which in excess is considered the major cause of illness. Provides overall immunity to the body. Next slide. Contraindications of Padabhyanga. Fever, cold, flu, indigestion, toxin-induced trauma, lymphatic infection, acute trauma to foot, abnormal skin conditions. Some of the oils or ghee used for Padabhyanga are Tir Tail, Gogrit, Kshirbala Tail, Mahanarayan Tail. The duration of next slide. The duration of Padabhyanga is 900 matra kal is the time for Abhyanga, which comes approximately to 5 minutes. Hence, 5 minutes Abhyanga can be done to get desired effect. Yogya kal, it can be done at any time of the day, but it is very beneficial when it is done at night before retiring to bed. Next slide. Here are some of the methods of Padabhyanga. 1. The hand techniques. In this technique, stroking and rubbing are included, and through this, we can generate better cardiovascular circulation in the foot. This friction also stimulates the flow of energy, directing it in the intended way. For this technique, sesame oil is commonly used. Second is the marma therapy. The feet have pressure points called marma. When pressed, it triggers the circulatory energies in the liver, kidney, stomach, neck, heart, head, and other organs. In Ayurveda, 5 marmas out of 707 marmas are located in each foot, and they also contain many nerve endings. Padabhyanga helps release all the negative energy from these marmas and contributes to good health and well-being. Third is the Kasa bowl. The Kasa bowl is made of mainly 2 metals, copper, major part, and tin, minor part. Literally a bronze bowl. This is also called as conservative foot massage. Massage with it balances the 3 doshas. Kansa is useful in netra roga. Next slide. Eye disorders. Timir, it is one of the Drishtigat Roga. It starts from Avyakta Darshan and ends with complete loss of vision. Padabhyanga has Chakshusha effect, hence it is useful in Timir Vyadi. Timir can be considered as refractive error. Hence, Padabhyanga is also useful in refractive error like myopia, hypermetropia, presbyopia, astigmatism, and amblyopia. Dry eyes. In dry eye, Ruksha Guna of Vata dosha increases and Snigdha Guna decreases. Oil massage to feet reduces the Ruksha Guna of Vata dosha. Computer vision syndrome. This is a Indriya Indriya Atiyoja vary. In this condition, Vata Prakop is more and oil massage over the foot helps. Next slide. Here is the procedure of Padabhyanga. Before doing Padabhyanga, first wash the feet with lukewarm water, then apply oil over the feet, covering the lower leg joints, soles, heels, and the toes by using fingers. Massage should be done in downward direction from ankles towards the toes, and around joints, massage should be done in circular manner. Supporting the heel with one of the hands, space between the toes is massaged. Each toe is firmly pressed and massaged from root to tip, and finally end the massage with soles. Moderate pressure should be applied at the end of massage. For Padabhyanga procedure, use single therapist for both the legs, because if two therapists are present, then maintaining synchronicity is not possible. Mode of action of Padabhyanga. According to Vagbhata, there are 4 major nerves present in feet that are directly connected to the eyes. These nerves help in maintaining good vision and relieve eyesight. According to Chakradatta, Padabhyanga is included in Chakshush, good eyesight, and other diseases of eye. Netra and Pada are 2 extreme poles of, and siras are the connected between these 2 poles. Hence, for any drug instilled at one pole shows its effect on the other pole, that is from feet to eye. These siras are not seen by naked eye. According to Yoga Shastra, these siras are considered as 2 nadis, like Pusha and Gandhari. Pusha connects right toe to the right eye, and Gandhari connects the left toe to the left eye, and it is useful in Netra Roga. Next slide. Abhyanga is more beneficial for the Tvaka, as Vayu is predominant in Sparshanindriya. Next slide. Conclusion. Padabhyanga is an important upakram explained in Dinacharya. It is easy, quick, and inexpensive procedure which makes people healthier and happier. Oil which is mainly used for Abhyanga is Tirtel, which is Chakshusha oil, easily available and economical. Hence, regular practice of Tirtel Padabhyanga is very beneficial for eye disorders. Next. Here are some of the references. Thank you.
Thank you, Doctor. Next, I invite Dr. Rashmi S. I invite Dr. Rashmi.
Yes, ma'am. Is my screen visible, ma'am?
Doctor, your screen is sharing now. Yeah, it's visible.
Yeah, okay. Good evening, everybody. Myself, Dr. Rashmi S, second year PG scholar from the Department of Shalya Tantra, Karnataka Ayurveda Medical College, Mangalore. So my today's topic is evaluation of plastic surgery techniques. Introduction. Acharya Sushruta, as we all know, is well recognized for his innovative method of rhinoplasty, extracapsular lens extraction in cataract, anal as well as dental surgeries. Acharya Sushruta was a famous surgeon of Kashi, popularly known as Banaras, and used to teach and practice medicine around 600 BC. Complicated surgeries like cesareans, cataract, artificial limbs, fractures, urinary stones, plastic surgery, that is Sandhana Karma, procedures including pre- and post-operative treatment, along with complications, are written in Sushruta Samhita, which are surprisingly applicable even in present time. The plastic operation of ear, that is autoplasty, the plastic operation of nose, that is rhinoplasty, is described in Sutrasthana 16th chapter. So here we can see Acharya Sushruta, who was the first surgeon to do the dissection on a cadaver. The father of surgery, Acharya Sushruta practiced and taught the art of surgery at the University of Banaras in the ancient city of the same name, located on the banks of river Ganga. His monumental treatise on surgery, that is Sushruta Samhita, established him as the father of Indian surgery. He was the first surgeon to systematize surgery by dividing into separate fields and is known as the originator of plastic surgery. Acharya Sushruta has described Taikshnam asvedam vepato asammohascha vaidyasya shastra karmani shasyate. The method of dissecting the dead body is given in detail in Sushruta Samhita, and plastic surgery was well developed even in this period. So the references of plastic and reconstructive surgery in Vedas, the oldest reference of Sandhana Karma found today, even before Acharya Shushruta, are of Vedic times. One of the famous example, as we all know, where Lord Shiva cuts the head of Ganesha in anger, and after knowing the truth and on request, they join the head of the elephant to the Ganesha. Similarly, other example like head of Yaksha was rejoined, thigh of Princess Vishala was replaced with that of the iron one. It is clear from all above example that organ transplantation and complete cure of diseases were done by Ayurvedic surgeons. The concept of reconstructive surgery in Ayurveda, the origin of Ayurveda occurs from Vedas. Rigveda is full of example of their works where they operated the eyes of Rishya Jiva, and the Acharya Shushruta has written Sandhana Karma, that is plastic surgery, in Sutrasthana 16th chapter, where he elaborated rhinoplasty for deformed nose, plastic surgery operation for deformed and cut ear lobules, corrective surgical procedure for cleft lip, injured lip, as well as cleft palate. So in the starting of the 16th chapter, Acharya Shushruta describes the method of piercing of ear lobule in infants for the purpose of decoration as well as giving protection from the Grahabada. So the first one, that is the technique for Sandhana Karma of the ear lobe, that is autoplasty. There are 15 operative methods to rejoin the injured ear lobule, namely Nemi Sandhanaka, Utpalabhedyaka, Valluraka, Asangima, Gandakarana, Aharya, Nirvedima, Vyayojima, Kapata Sandhika, Ardhakapata Sandhika, Sankshipta, Hinakarana, Vallikarana, Kakaushta, and Yashtikarana. So the indications for different methods, wherein he tells Nemi Sandhanaka is to be done when both the part of the earlobes is Utpalabhedyaka when both earlobes are circular, wide and equal. Valluraka when both earlobes are small, round and equal. Asangima when inner part of the earlobe is long. Aharya when both earlobes are absent. Nirvedima when both earlobe is separated from the root. Vyayojima when the earlobe is small, heavy, equal and asymmetrical. Kapata Sandhika when inner part of the earlobe is long and outer is short. Ardhakapata Sandhika when outer part of the earlobe is long and inner is short. Sankshipta when the pinna or the auricle of the outer lobe is dry and absent and second part is short. Hinakarna when the base of the earlobe is absent and the little musculature is present. Vallikarna when the earlobe is thin, asymmetrical and minor residues. Yashtikarna when the flesh of the earlobe is glandular, vascular and stunt and lobe is minor. And last one, that is Kakaushta, when earlobe is unshielded, small and minor vascular. So here you can see the repair of the earlobe that is being done. Nasa Sandhana Vidhi, that is rhinoplasty, described in Shushruta Samhita 16th chapter, the Karna Vyadabandha Vidhi Adhyaya. So he has given the indication for the nose either lost by a disease or by trauma or accident. The portion of the nose has to be covered first, measured with the leaf. Then a piece of skin of the required size should be dissected from the living skin of the forehead or cheek and turned back to cover the nose, keeping a small pedicle attached to the skin. The part of the nose to which the skin has to be attached should be made raw by cutting the nasal stump with the knife. The physician should then place the skin on the nose and stitch the two parts, keeping the skin properly elevated by inserting two erandanalas in the position of nostril so that the new nose gets proper shape. And after this, the churna of lal chandan, muleti, raso, that is Barberries aristata, should be sprinkled over the operated area. Then the operated part should be covered with a cotton pad or gauze piece and irrigated with tilataila frequently. Oshta Sandhana Karma, that is a reconstructive surgery of the cleft palate. The injured lip or congenital cleft palate is also reconstructed by same method, what is discussed for rhinoplasty, but the only difference is that in this lip surgery, there is no use of erantanala. So as you can see the image, the cleft lip as well as the cleft palate that has been repaired. Conclusion. Acharya Shushruta has described various reconstructive methods and different types of procedures like taking a flap of skin from the cheek region with the pedicle attached to the donor side. So it can be concluded that the source of plastic surgery is Sushruta Samhita, the great Indian Ayurvedic surgical literature. From here, it spread worldwide. Thank you.
Thank you, Dr. Rashmi.
Thank you, Dr. Rashmi. So, next, I invite Dr. Chanagaud Patil. I invite Dr. Chanagaud Patil.
Yes, ma'am. Hello.
Yes,
You
doctor,
are
you're
audible,
audible.
doctor.
Yes, sir. Sir, audible, sir?
Yes, doctor. Please share the screen, doctor.
Yes, sir. Yes, sir. Sir, please share my screen, sir. Share नहीं हो रहा है sir.
Okay, doctor, I will share for you.
Yes, sir. Thank you.
You can please start the session, doctor.
Yes, sir. Yes, sir. Yes, sir. Next. Okay. Ayo kamaya manina dharmartha sukhasadanam ayurveda upashisheshu deyu paramadara. Good evening, everyone. Myself, Dr. Chanagouda Patil, first year PG scholar, Department of Roga Nidana, Ayurvedic Mahavidyalaya, Hubbali. Now I am presenting the topic on the role of the Samprapti in prognosis under the guidance of our beloved HOD, R.I. Timapur sir. Introduction part. This is the mainly purpose of objective of the Ayurveda, then development of the technique skill in the scientific knowledge and human understanding, the acquire completing knowledge for the diagnosis and prognosis. So the fulfill of the subject patient should develop the technical skill and scientific knowledge and understanding the complete knowledge of diagnosis. Take the reference from Acharya Charaka, Vagbata, Madhav Nidan. The next one, sir. Then also it is according to Ashtanga Hridaya Nidana. I have explained the Nidana, Pura, Rupa, Upashya, and Saprapti. All of them subjective, well objective applied to the understanding of the diseases. Then here the one of the Sloka Madhav Nidan will explain the Yata Dushtina Dosho Yataha Chanosattavaha Nasoto Ramayashasho Sampraptana Jatanaganata. It means mainly explain the understanding the Jati Andagati process of the understanding the development of the disease by the visits for the constantly inside of the body. Then the next one synonyms of the Samprapti. Those are Samprapti, Jati, Agati, Nispati. These are the synonyms of Samprapti. Next slide. Then classification of the Samprapti. According to Charaka, there are the 6 types. According to Sushruta, there are the 5 types. According to Charaka, Sankhya, Pradhanya, Vidhi, Vikalpa, Bala, and Kala. Next slide. Then detail explaining of the types of the Samprapti. First one is Sankhya Samprapti. Mainly Sankhya Samprapti explains of the numbers of the diseases. Those are Jwara, Gulma, Kasa. Like Jwara are the 8 types, Gulma are 5 types, Kasa are 5 types. Then they right on this slide will explain the Samprapti Gataka, how to water will accumulated the different kinds of the areas, how to vitiate it. Same only is Samprapti Gataka in our body, how to vitiate diseases. The next one is the Pradhana. Pradhana Samprapti means helps to identify the dominance of the doshas. In case of 2 or more doshas involved. Like example, 2 doshas word Aptara used to denote the dominance of the comparison of other doshas. 3 doshas involved with the Sama used to dominance of the other 2 doshas. Next one, sir. Then Vidhi Samprapti will explain the disease like variation of the disease that Nija and Agantija. 3 varieties of doshas based on their visualization. 4 variety of diseases based on the prognosis of disease, curable, incurable, mild, and acute. Then Vikalpa Samprapti will indicate the proportional analysis of the qualities of doshas involved. For example, in case of Vata, Involvement of Samana, Vyana, Apana, Prana, Udana involved either single or mixed to all. Such observation can be understood by the knowledge of Vikalpa Samprapti. Vikalpa Samprapti also helps to detect the qualitative, quantitative, and functional aggravation of the dosha. Next, sir. Bala Samprapti. Bala Samprapti mainly explains the strength of the disease based on the positive factors or involvement, organ involved, age, etc. Helps to assess the strength of the disease. Next one, last one, Samprapti is Kala Samprapti. It indicates the times of aggravation of doshas in relation to season, varying time of the day, night, and intake of the food. For example, Kapaja Jwara in Vasanta Rutu and Kapaja Jwara aggravates in afternoon and early night. Kapaja Jwara aggravates just after intake of the food, aggravating and the relieving factors of the disease may be understood by this. Next one, sir. Then next point is discussion. These are the main important diagnostic tools in Ayurveda. If they are used to proper method, they will be useful in the diagnostic prognosis of the diseases. After the proper use of this Samprapti, the disease manifestation can be stopped and can be cured easily. Samprapti is a very useful way to diagnose the given in Roga Nidana. So proper knowledge of Samprapti approach is essential for the diagnosis of the disease. Next slide, sir. These are the chart. Here the Shat Kriya Kala, how to initiate pathogenesis in the Samprapti Gataka. So, next slide, sir. Then last only will come for conclusion. Samprapti helps to diagnose the contributing factor of the diseases. Samprapti helps for describe the Samprapti Vikatana Chikista. It also helps to plan the Samshodhana, Samshamana, and Langana therapy based on the mortality of the doshas. So the Samprapti is considered one of the diagnostic tools which can play an important role in treatment of the disease. Next. Thank you for everyone for giving this detailed opportunity. Thank you, sir.
Thank you, doctor. So next, we have a paper presentation by Dr. Sonal Ananda. I invite Dr. Sonal Ananda.
Dr. Sonal Ananda Kandalkar, please unmute, doctor.
Hello.
Hello, doctor. You are audible, doctor. You are audible, doctor.
Okay. My name is Dr. Sonal Kandalkar, PG student from Sanhita department from Shri Saptashungi Ayurveda Mahavidyalaya, Nasik.
Excuse me, doctor. Your PPT is not visible. Your screen is visible, but your PPT is not visible, doctor.
Okay, just wait.
Okay, doctor.
Okay. Sir, अभी screen आ रही है?
No, doctor, not visible. Your PPT, doctor. Once again, can you please share, doctor?
Just wait.
Now it's visible, doctor. Please start the session.
Okay. My topic is role of Ayurveda in sports medicine. Ayurveda is an ancient Indian system of medicine. The term Ayurveda combines two Sanskrit words, Ayu, which means life, and Veda, which means knowledge of science. It is one of the oldest systems of medicine in the world. Still, that through to the time. Sport medicine is a branch of medicine that deals with the physical fitness and the treatment and prevention of injury related to the sport and exercise. Direct references of this neither mentioned in ancient or nor in modern medicine. It is nothing but the application of various medical principles to the sports activities, physical exercise.
Introduction of my topic is sports medicine is not described as such in ancient or modern medicine. Sports medicine is nothing but the application of various medical principles to the sports activities, physical exercise, and performance endeavors. Sports medicine have two goals to achieve. Primarily, fitness of the sport medicine, and second goal is treating the sporting injuries of the sportsman. Then we will see relevance. About 30% population of India are engaged in various sports. 60% sportsmen sustain various injuries in field. 30% of the above are permanently unfit for further sports life. Moreover, rest are not fit in the true sense with existing treatment. Then we will see Ayurveda interpretation of sports. Ayurveda as a sports medicine is a relatively new concept. Although ancient India relied upon this system to treat and maintain the well-being and its warrior folk, the long-term effect of overdoing sport are especially unhealthy. Your body loses its balance and its resources and depleted. Concept of sports injuries are their management, and their management can be spotted in the Ayurvedic Sanhitas like Bhagna, Sadyovran, Snayugat Vata, Vrana, Shotha, Kandaragat Vata, Maunsagat, and Sandhi Mukta. Then we will see Ayurvedic treatment of in sports medicine. First one is Prakriti Sthapan, to regain physical fitness of sports person and send him back to the field as early as possible by protection, rest, medication, and physiotherapy. Then in internal medication, we will use Bala Tailam, Dhanvantar Tailam, Maharaj Prasarini Tailam, Mahamash Tailam, Krishabala Tailam, Lakshadip Gugul, Yograj Gugul, Vat Vidvansak Rasa, Panchatikta Bhuta Gugul. And the uses are to boost up tissue healing, to elevate pain, to strengthen the injured part. Then we will see external therapies: Abhyanga, Udvartan, Utsadan, Mardan, Upamardan, Samhan, Pidan, and Upaveshtan are the external therapies. Then we will see Lepan or Alepan.
Hello, doctor.
Yes.
Okay.
Am I audible?
Yes, doctor. Audible, doctor. Please continue.
Okay. Rakta Prasadan, Karma, and hot potency, Vranaropan and Pitta Shaman, Ushna Guna and Madhura Rasa act as a Vat Shama. During the process of drying may cause local pressure and stiffness. So these are uses of Lepan. Next. Hello? Sir, just wait.
Okay, doctor.
Actually, मेरी slide नेट पे नहीं जा रही. Just wait. Sir, slides visible हो रही?
Slides are visible, doctor.
Okay. Then next one is Katibasti benefits. Nourishes lumbar and sacral vertebrae. Stimulate proper blood supply to the lower limbs. Gives strength and stability to the lumbar spine. Strengthening the low back muscles. Then next one is a Bandhan. Bandha means bandaging, which used for dressing purpose, post-operative care, and surgical management of injury. Bandage with or without oil massage. 15 types of Vrana Bandhan are described in Ayurveda. Then next one is Anushastra Karma. This includes parasurgical procedures including Agni Karma and Rakta Moksham. Then we will see food and drinks. Fleshy prepared food and beverages are good for fitness. Regular meal times are pleasant for the body and allow it to digest food perfectly. Then next one is the rasayanas. Amla juice has been designed as a sport rasayan for physically active person. It has holistically nourishing and balancing as well as natural anabolic. That is a muscle building. Then next one is a yogasana. Yogasana are sequentially coordinated postures that will not only increase flexibility but also improve the mind-body coordination. Then next one is a relaxation. After exercise, a sufficient regeneration period is important as the sport itself. Then next one we can see kalpa, soft gel capsules, gandha taila, dhanvantaram cream, bone tone capsule, dazzle cool cream or powder, and rumalaya lakshadi gugul. The classical medications are Vranaropan Tailam, Pinda Tailam, Murivenna, Shatavari Tailam, Marma Tailam. Then next one is among the 15 Mahakashaya. Bruhaniya Gana, Jivaniya Gana, Balakara Gana, Shramahara Gana. These are 15 Mahakashayas. Then next one is the conclusion. Ayurveda is a science of life which takes to the time. Even sport medicine is a new branch developed. Still, Ayurveda has all solutions related to the sports science. Ayurvedic medicines have potent action in acute and chronic injuries. Use of external application and internal medication found to be best in the healing of injuries and prevent edema, stiffness, muscle wasting compared to the modern treatment. Thank you. Yes.
Thank you, doctor.
Next, I invite Dr. Mithun. I invite Dr. Mithun M. Devappa.
Yes, ma'am. I'm able to hear. Am I audible, ma'am?
Yes, doctor, you are audible. Please share the screen.
Okay. Hello, ma'am. Ma'am, actually, I am not able to share my screen. Can you please share, ma'am? I already sent to sir.
1 second, doctor.
Hello, Dr. Mithun.
Yes, sir. Yes.
Doctor, I will share for you, doctor.
Yes, sir.
Start the session, doctor.
Yes. Yes. Good evening, all. Myself, Dr. Mithun M. Devappa, third year PG scholar from Sri College of Ayurveda. Today, I am going to deal with the topic millets, small but mighty. Next, these are the contents of my presentation. First, we will see the introduction part. So, can you please? Introduction. The word millet is derived from the French word millet, which means handful of millets contain thousands of grains. The term millet is used for the smaller grains, which are eaten without having the outer layer removed. As in recent years, due to the different variations in lifestyle, we are suffering with more non-communicable diseases. To prevent these non-communicable diseases, various dietary changes have been playing a vital role. In the dietary practices, millets has been incorporated as the main thing, and with their highlighting their nutritional richness and health benefits. Actually, this year is declared from the UN government as the International Year of Millet, because to create a awareness among the people of their nutritional value, and these millets, along with their nutritional value, they are environment friendly also, because they will use the low water input and very tolerant to the heat. That's why this year has been declared as the International Year of Millet by the UN Council. Next slide, sir. So mainly, next we will see the types of millet. Based on their size, millet has been classified into major millets and minor millets. Major millets are sorghum millet, pearl millet, and finger millets. Minor were foxtail millet, proso millet, little millet, kodo millet, and barnyard millet. Next, we will see about the major millets. In that, sorghum millet is called as a king of millets. It is rich in the slow digestible starch. Then the pearl millet is rich in the magnesium contents, and along with that, essential amino acids like threonine, lysine, cysteine is present in the pearl millet. In the finger millet is the third one. It contains the more of the calcium and fiber rich. In that, it has a carbohydrate content. In that carbohydrate content, 59 to 70% of the starch. Next slide, sir. So next we will see the health benefits of the major millets. Health benefits of major millets. In the celiac diseases. In this condition, as the person suffering with the genetic predisposition, here he is suffering with the allergic to the gluten. Here the millets like pearl millet and the sorghum millets were the gluten free. So we can use them in the celiac diseases. Obesity, we can use these millets. They are fiber rich and they slow down the bowel function and they give the satiety feeling. So we can use these millets in the obesity. And these millets also decreases in the LDL and HDL levels. And the low glycemic index of the millets helps in the prevention of the diabetes mellitus. Next slide, sir. In pearl millet, actually have the magnesium content more. This magnesium content can be used in the asthma patients and helps to reduce the migraine attacks also. The calcium present in the finger millet helps in the bone development, and it has the valine, isoleucine, and methionine amino acids. As this isoleucine helps in the muscle repair and blood formation, and valine is essential for the metabolism and muscle coordination. It will be helpful, and these millets were the helps in the oxidative stress. Because of these free radicals, the antioxidant property of millets will helpful in the oxidative stress. So next slide. Next, we will see about the minor millets. In that, 5 to be there: foxtail, barnyard, proso, little, and kodo millet. Foxtail millet, it is having the good antioxidant and low glycemic index. Barnyard millets, it is rich in phosphorus and magnesium. Proso millet, which is rich in leucine, isoleucine, and methionine. It is protective against the D-galactosamine. Little millet, it is slow digestible, and the water gum property will be helpful in treating the metabolic diseases. And kodo millet, it is phosphorus rich and antioxidant property also rich in the kodo millet. Next, we will see about the nutritive value of the APEDA. This is the chart of nutritive value of all the millets. Next, we will see about the health benefits of small millets. In this, small millets will helpful in reducing the LDL and increases the HDL levels. And it is also have the low glycemic indexes in preventing diabetes mellitus, and it helps in development of body tissue and energy metabolism. They were rich in antioxidants. Next, we will see the pseudo millets. These are actually not the major millets, major millets. These are the pseudo millets. They are amaranth and buckwheat. Amarnath or Rajgiri, it is called as. It is rich in cholesterol lowering properties. Buckwheat, which is rich in the starch and routine bioflavonoid, thought to be helpful in blood pressure. Next, we will see the anti-nutrients properties of the. Sir, please change the slide. So next. I already pseudo millets. Pseudo millets are two, mainly Rajgiri and buckwheat. Rajgir is rich in the cholesterol lowering properties and rich in magnesium, potassium, and calcium. And buckwheat, it is rich in the routine A bioflavonoid, thought to be helpful in the blood pressure. Next, we will see the anti-nutrient properties of the millets. Can you please change? Anti-nutrients of millets and its reduction properties. Anti-nutrients means the compound that bind to with nutrients present in the body and make them less available absorption by the human body. These are called anti-nutrients. They were phytates, polyphenolics, tannins. Actually, anti-nutrient strategies like heating and soaking, germination, fermentation, and by biological intervention, we can reduce the anti-nutrient properties. Next, we will see the different preparations we can use presently at the current era. So can you change the slide? Yes, these are all the different preparations which were explained by the Indian Institute of Millet Research. These are the recipes available in the Millet Recipes, a Healthy Choice. This is the book by the, next we'll see, sir. Next. Millet Recipes. This is the book which is published by the Indian Institute of Millet Research. We can prepare different preparations by using this protocol. Next we will see the Ayurveda view. Our classical references have they more not discussed much about this thing about Kudanya Vargas. We will see the references. Millets have been given synonyms like Kudanya by Charaka, Shudradanya by Bhava Mishra, and Trinadanya by Acharya Kayadeva. These are all the list of millets according to Ayurveda. Kangu, it is foxtail millet. Shamaka is barnyard millet. Koradusha is kodo millet. Nartaki is finger millet. Gaveduka is adlai millet. And Yavanale is sorghum. Next, we will see the rasa panchakas of millets. They are commonly, the rasa is Kashaya Madura, Vipaka is Katu, Virya is Shita Virya, Guna is Lagu, Ruksha, effect of Tridosha and Dhatu, it is Kapha Pittahara, Vatala and Rakta Shamaka. Next, we will see the specific gunas of each millet. Kangu, it is Guru Sangrahi and Durchara. Shamaka is Sangrahi and Dhatu Shoshaka. Kodrava, it is Madhuratikta Rasa and it is Aurusha. Chanaka is Durchara and Durjara. Brahmana, Bhagna Sandhanakara. Nartaki, that is finger millet, it is Balya and Rusha. Yavanala, it is Aurusha, Rucha and Trushnagna. Next, discussion. Analyzing the general properties of effect of millets obeys idea that millets are advised in Kaphajaroga, Pittajaroga, and Rakta Dushti. Based on the understanding grass indication, so we can use the millets in Staulya, Kushta, Prameha, and Atisara and Medarogas. Advising the millets based on their one's Agnibala. It is very important to as they are Guru and Ruksha, which makes them difficult. That is Durchara for easy digestion. But both these qualities given the satiety feeling, and they have the Lekana, play the Shoshana property, so which will be useful in the Santarpanajanya Vyadhi. We will see one example, that is Kangu millet, which is Sangrahi, and Grahani. It can be used in Grahani. Kangu is both Brahmana and Shoshana, which means it can be used in Dhatu Shoshana, like anti overnourished dhatus like Meda and Mamsa. Meanwhile, it will also provide nourishment to supply the micronutrients. This principle works best in the Staula and Prameha. Next, contraindications. So, analyzing the properties of the millets, we can see that millets have the general properties of Ruksha and Vatakara. So, it is contraindicated in Sandhigata Vasa, Shosha, Karsya, and Agnimanda, Ajirna, and Vibandha conditions. If millet have to be used in the above conditions, samskara should be done by balancing the vata. So it teaches the digestion by soaking. It teaches and digestion like soaking millets in warm water before cooking, adding ghee with preparations, adding Dhoopana and Pachana drugs along with the preparation. So these are all the next one slide. Hello. These are the cross references. The effect of sprouting on the proximity composite of proso millet. This sprouting increases the fiber content. Next slide, sir. Next one is nutrition comparison with millets with the superfoods like flax, chia seeds, and all. Here, the ability to grow millet in marginal sites with no irrigation facility could help the worldwide achieving the targets of food security. Conclusion: modern sophisticated sedentary lifestyle is giving rise to epidemic like non-communicable diseases. Millets are best be used to treating Santaprajanya Vikaras, Kapha Pittaja Rogas. Millets can be used in preventive diet in healthy therapeutic diet in diseases, but they should be avoided cautiously used in Vataja Vyadhi by assessing the one's Agni. These are the references. Thank you.
Thank you, Doctor.
Thank you, Doctor.
Yes.
Next, I invite
So
Dr.Bhagyashri Bhaurao Ghune for the paper presentation. Dr. Bhagyashri, are you there? Hello, Dr. Bhagyashri Ghune, are you there? Hello, Dr. Bhagyashri Ghune, can you hear me? Please unmute, Doctor. Hello, Dr. Bhagyashri.
Hello. Yes,
Hello,
sir.
Doctor. Please share the screen, Doctor.
Okay, sir. 1 minute. Hello.
Hello, Doctor. You have any problem with screen sharing, Doctor?
Yes, sir. I can't share screen.
Okay, Doctor. I will share for you. Please start the session, Doctor.
Title: Study the efficacy of Aragwadha Phalmajja in management of Dushtavan with special reference to infected wound. My name is Dr. Bhagyashri Ghune. I am PG student of Shalya Tantra Department at CSMS Ayurved Mahavidyalay, Chhatrapati Sambhajinagar. Title: Clinical Study to evaluate the efficacy of Aragwadha Phalmajja Kashay Dhawan in the management of Dushtamana with special reference to infected wound. Abstract: Wound is break in integrity of the skin or tissue, often which may be associated with disturbed information of the structure and function. It is correlated with Dushtamana in the Ayurveda. After injury, healing is natural phenomena of and continuous in sequential matter until the formation of as a healthy scar. For the management of Dushtamana, Acharya Sushruta incorporated number of drugs broadly classified into Varna Shodhana and Varnaropana. It is need to find out rational and optional healing compound for the wound management in better way. Acharya Charka has started Shodhana is perfect treatment for Dushtamana. Acharya Sushruta has stated that Kashay of Aragwadha the dravyas in the management of Dushtamana. Infected wounds are more complicated to heal, generally require hospitalization, but application of Aragwadha Phalmajja Kashay is parasurgical process which don't need to hospitalization. Also, it is more effective, multi-purposes, and economically affordable, easy to use. Introduction: as a scar of wound never disappear even after complete healing, it's impressed persistent after long. It is called vrana. Wound is a break integrity of the skin or tissue of one which may be associated with distribution of the structure and function. There are 6 types of vrana according to Acharya Sushruta. Chinna Bhinna with the Shitya, Picha and Grushta. All the above are Sadhyavana which get converted into Dushtamana if not treated properly within 7 days. There are many measures to create favorable condition for wound healing, such as use of antiseptic solution of many topical, disluffling and debridement agent which promote healing, but there are certain drawbacks of this agent like damage to healthy granulation skin, local skin, etc. Since the immediate, it has been an ongoing process to search out better remedies in order to overcome this previous drawback. Acharya Charka has stated that Shodhna is perfect treatment for Dustavana. Acharya Shushruta has stated that the Kashai of Aragwadi Dravyas in the management of Dustavan. Infected wounds are more complicated to heal. Hello.
Hello, doctor. Please continue, doctor. You are audible.
Yes, sir. Infected wounds are more complicated to heal, generally require hospitalization. No. Application of Aragwadha Phalmajja Kasha is parasurgical process which don't need to hospitalization. Also, it is more effective, multi-purpose, economically affordable, easy to use, and also are no chances for allergy. Infected wounds are more complicated to heal. Sir, Aragwadha Phalmajja Kasha is plant origin drug medicated by the Quath procedure described by Sushruta. Material and method. Case reported 34-year-old male came with non-healing ulcer. History of 2 months back. He was accidentally injured by steel jar. The wound is formed over dorsum of the right foot. He was treated with providine iodine ointment by local doctor but failed to respond. After a few days, ulcer got infected by with freely flowing pus. No history of any previous illness, no history of any drug allergy. Patient was diagnosed with Dustavana. Local examination, infected wound measuring about 5 to 5 into 0.5 centimeter with purulent discharge. This is the shloka by Shushruta. दृष्टवनेषु कर्तव्यं मूर्धं चाद्य शोधनं विशोषणं तथाहारं शोणितश्च च मोक्षणं काषायं राजवृक्षय सुरो साध्योच्च धावनं तये रेव कषायेनं तैलं शोधनं मिश्यते क्षारकल्पेन वा तैलं क्षारद्रव्येषु साधितं द्रव्या आरगवत फैमिलियम लेग्युमिनेसी लैटिन नेम कैसिया फिस्टुला रस मधुर वीर्य शीत विपाक मधुर गुण गुरु मृदु स्निग्ध प्रयोजांग फलमज्जा फल त्वचा पुष्प पत्र मूलत्वक. Drug formulation detail, method of preparation according to Sharangdar Sahita. First part of Aragwadha Phalmajja plus 4 part of water is taken and boiled till 1.5 part is remain. 125 mg Aragwadha Phalmajja is taken, half liter water added in Phalmajja and taken for boiling till 1:4 part of water is remain. Hence 125 of decoction prepared. Then after it began of Sushkoshna Kasha used for Dushtavan Dhawan. Route of drug administration, name of drug, Aragwadha Phalmajja Kashay, duration 15 days, Kal morning, dose once a dose, route of drug administration, local application wound, that is Dhawan. Treatment every morning, the wound was clean and freshly prepared. Leukemia Aragwadha Phalmajja Kashay. After cleaning dressing was done with sterile gauze and bandage. Result, clinical feature of Drustavana was resolved at the end of the first week and healthy granulation started. The wound was healed and completely at the end of second week. leaving the healthy scar. With a follow-up for a period of 1 month, the patient had shown no sign of recurrence. That is three picture before treatment, during treatment, and after treatment. That is after 1 month. Discussion: effect of Vrana Vedna. Pain and tenderness was completely reduced at the end of treatment. Throbbing pain, which was present at the beginning, was completely reduced at the end of first week, and purulent discharge decreases because of Shodhan property of Aragwadha Phalmajja. Effect of Varna, change in color aqua when Drushta one got converted into Shuddha, which was due to elimination of dosha out of body. At the end of first week, slough was completely reduced and color of the floor become pinkish and healthy granulation tissue appear. Effect of Varana Srava at the end of the first week, purulent discharge from the wound was completely stopped. This may be due to Shodhana and Dhoopana property of Aragwadha Phalmajja. Effect of Varanagandha, foul smell present at the morning of the treatment was completely reduced at the end of the first week. Smell was due to the pus and Varana becomes Shuddha at it decreases. Effect of Vrana Akruti on the 15th day, Vrana was completely healed. This may due to Vrana Shodhana property, Aragwadha, which provide ideal environment for wound healing. Conclusion: Dhawan Aragwadha Phalmajja Kasha is the new substitute for Dushtavana. It does the action of Shodhana and Dhoopana too. It is simple open level procedure, relatively painless, can do without anesthesia. Varna Dhawan will remove only unhealthy granulation and slough, so wound size does not increases. References. Shall I also read references, sir? Hello. Hello.
Hello, doctor.
Shall I also read references?
Yes, doctor.
Okay.
Please read.
Can you please share the screen? References first. Professor J.D. Singhal and colleague Sushrut Sahita, Ancient Indian Surgery, Chaukhamba Sanskrit Prakashan, second edition, 2007. Sushrut Khan, 2140, page number 200. Second, Dr. Brahmananda Tripathi, Charak Sahita, part 2, Chaukhamba Subharti Prakashan, 2018. Chikitsastan, 25.
Thank you, Dr. Bhagyashri. Thank you, doctor. Thank you for the
Thank you, sir.
session.
Thank you, sir.
Next, I invite Dr. Deva Vijayan Nambiaril for the paper presentation. Dr. Deva
Hello.
Vijayan, are you there?
Yes, sir. Sir, can
Okay,
you hear
doctor,
me?
please. Yes,
Sir,
doctor, you are audible, doctor.
I have some difficulties in sharing the screen. Can you please share the screen for me?
Okay, doctor, I will share for you. Just a moment, doctor.
Okay, sir.
Doctor, please chat the system.
Okay. Good evening, all. Namaste. I am Deva Vijay Nambialil, from Aru Rashmi Narayana Rao, Koppa. Today I am going to present the therapeutic properties of Mandukaparni. So Mandukaparni is a quite common drug. It's mainly seen in our backyards. It doesn't need any support to grow. Usually we eat this in our day-to-day basis as chutney or some palya or made in some other form by our mothers. So today we are going to see the therapeutic properties of the drug. Sir, first slide, can you please? Hello. Content. So today I am going to discuss regarding the introduction of Mandukaparni, the traditional uses of it, cognitive enhancement, and the anxiety and stress reduction, safety precautions and considerations, conclusions and reference. The next slide, please. So, Mandukaparni. Mandukaparni, in another name, it is called as Gottu Kolu or Ondalga Soppu. So here there are many references in our Vedic period in Atharva Veda, and Kashyapa Samhita had explained that Mandukaparni is the best enhancers of intellect, and it is a very good drug for the Rasayana purpose also. So here I have chosen the Susruta Samhita references. The Susruta Samhita reference, Brahmi Vapi Mandukaparni Jivani Cha Estrayaha Sarvabhi Rogeshu. This loga tells us that if one has these drugs like Brahmi, Vapi, Mandukaparni, Jivani, etc. in our courtyard, so it can conquer many diseases. So Mandukaparni, its the scientific name is Candela asiatica, and its roots grows like how a frog jump from one place to another. The same way its root propagates, and hence it is called as Mandukaparni. So the properties of Mandukaparni are it is a best adaptogenic, antioxidant, and neuroprotective properties. So the traditional uses of Mandukaparni are it supports the cognitive function, improves the memory, and promote overall well-being of a person. So the wide ranges of applications, we can see it in both Ayurveda or traditional medicines and in Chinese medicines as well. So the next slide tells us the traditional uses of Mandukaparni. Mandukaparni acts as a brain tonic, nervous system supporter, rejuvenative and longevity, helps in skin health, digestive support, anti-inflammatory and antioxidant properties, and it also helps in supporting the joint and bone health. Set the next slide, please. So now we are going to discuss regarding the cognitive enhancement of Mandukaparni. As I explained in the previous slide, that Mandukaparni is a rejuvenating the nervous system. Mandukaparni nourishes and strengthens the nervous tissues, and it helps in balancing the Vata dosha by support. It supports the clarity and other functions also. So we know that Mandukaparni is the best vasodilator. So it helps in widening the blood vessels and helps in easy blood flow, and it stimulates the collagen in the blood vessels and stimulates the collagens. So it protects the cells from damage and recreate the neural connections and improve the cognitive function. Here we can see the other properties also. So I have explained how it stimulates the blood circulation and hence promoting the cognitive enhancement, and also antioxidant and neuroprotective effects of Mandukaparni helps in promoting the brain cells from oxidative stress and damage caused by free radicals. So it also helps in transmitting signals and facilitating communication between the cells, brain cells faster. The next slide, please. Next, we are going on to the antioxidant, anti-anxiety, and stress reduction properties. So So Mandukaparni calms the mind as it is a Swatik food. If we are including Mandukaparni in our day-to-day basis, it can give a purity, clarity and harmony, and also reduce the mental agitation, restlessness and anxiety in patients. And also it is a best OJS enhancer, as it helps in increasing the OJS if once OJS is depleted, and restore it and get relief from stress also. So nourishing the nervous system, Mandukaparni is a Medhya Rasayana as explained by Kashyapa Samhita, and it strengthens the nerve tissues and enhancing the ability to cope up with stress. So next slide, please. What are the safety precautions and consideration one should consider before consuming Mandukaparni? Because if some persons are allergic to Mandukaparni, they should understand while using Mandukaparni in a raw form, and excessive intake of any drug can cause not good betterment in the patient. So excessive use or prolonged use is prohibited, and obtained Mandukaparni, we should ensure that the quality and authenticity is good before taking Mandukaparni, and before consuming Mandukaparni, we should consult the healthcare professionals or Ayurvedic doctors. The next slide. So here we are coming to the conclusion. So Mandukaparni is widely used as a therapeutic in traditional system of medicine. It is a best Medhya Rasayana and promoting the brain health and support the optimal cognitive function. It has calming effects on the mind and nervous system. It supports the emotional balance and relaxation. It exhibits neuroprotective properties and helps in promoting the brain cells from oxidation, stress and inflammation. So it is considered as adaptogenic herb, help the body adapt to stress and promote overall well-being. Thank you.
Thank you, Doctor.
Thank you, sir.
We are coming of the session. I would like to invite Dr. Aishwarya to conclude the session.
Thank you, Dr. Sabin. So thus we come up to the end of today's session, and one more day is left. And before end, I would like to extend my sincere gratitude to our faculty members, and I congratulate all our participants for their excellent participation. So we'll meet tomorrow. Until